Hello, I'm Dr. P. What do we have today?
This is Alyssa. She's a 55-year-old Hispanic woman. She has a history of type 2 diabetes. She was diagnosed with it, in fact, in 2008. She's been a smoker for 40 years, and she has an 80-pack here. She has a family history of atherosclerosis, and she's been working in a high-stress environment as a correction officer for 35 years. She was admitted with acute chest pain that radiated to her left arm. She presented with dyspnea, pallor, diaphoresis, and nausea. Alyssa described the pain as sudden and crushing, as if someone was sitting on her chest. She thought she was having indigestion. Oxygen therapy has been administered per order.
Okay, let's have an EKG done to see if our ST segment is elevated. If it is, this would depict a blockage that could be from atherosclerosis. Try and make the patient as comfortable as possible.
Hello, Miss Oliveira. How are you today?
Good, how are you?
Pretty good. Would you mind if I call you Alyssa?
No.
Okay. How are you feeling today?
I have a pain in my chest and it hurts. I'm having a hard time breathing.
Okay. On a scale from 1 to 10, what would you rate it?
An 8. What is going to happen to me? I just want my daughter.
Okay. We'll get you some medication for the pain temporarily. Get an order from the doctor. And we're going to do an EKG, meanwhile, to check the electrical activity in your heart. From there, we can see the results and go from there.
Thank you.
11 minutes later.
You can take a seat right here.
Okay.
So, your EKG shows there is an elevation in the ST segment. To treat this, you'll need to get sent to the cardiac cath unit, and you'll have an angiography stent put in.
What is that? Is it going to hurt?
This will show the blockage in your heart, and then from there we can open it up and relieve the blockage if necessary. And hopefully that'll relieve some pain.
Thank God.
Mrs. Oliveira, before you get sent up to the cardiac unit, a tech is going to have some labs tested. Let me know when her results are in. I want her troponin, serum lipid profile, CK, and C-reactive protein.
Later that same evening.
Alyssa's lab reports just came in. Her troponin level is elevated to 0.25 nanograms per milliliter, which is high since the normal is 0.04 or 0 to 0.04 nanograms per milliliter. Her serum lipid profile came back as elevated as well. The normal finding, which is less than 200 milligrams per deciliter, her total cholesterol, and hers came back as 250 milligrams per deciliter, so hers is elevated.
This shows that she has a great risk for heart disease. A normal CK level is 22 to 109 units. Higher amounts, such as hers being 155, indicate muscle damage, ultimately showing she had an MI. Increased C-reactive protein indicates systemic inflammation occurring. A normal level is below 3 milligrams. Her results were 7 milligrams.
What's wrong with my mother and what do the tests mean?
These reports signify that she had a myocardial infarction, also called a heart attack. This was related to her lifestyle habits and prior atherosclerosis.
How did this happen? I don't understand what makes her heart so bad.
Well, basically what happens is an interrupted blood flow in her arteries. The cells continue to produce ATP, which is energy, and after 8 to 10 seconds without oxygen, the cells begin to go ischemic or cyanotic. When cells get injured, they start to malfunction, causing electrolyte disturbances, arrhythmias, and ultimately cell death. There is an increase in blood volume and blood pressure when this happens.
All this stems off from her family history, her basic lifestyle, and her dietary habits.
Oh my goodness, Mom, you must stop smoking.
I'm getting a stabbing pain!
Are you okay?
I can't breathe!
Electrocardiogram on you. Just relax. You might have gotten pericarditis secondary to your MI. In the meantime, I'm going to prescribe some pain meds for you, okay? Just relax.
Okay, the doctor ordered some morphine. I'm going to go get that for you. What morphine is, it is a pain reliever, and it will vasodilate your blood vessels, which means it'll decrease your blood pressure, heart rate, and how hard your heart is working.
Thank you, nurse.
1 minute, 37 seconds later.
Well, it looks like you have not only pericarditis, but also cardiac tamponade. This can occur from the pericardium rubbing against the outer layer of the heart.
What exactly is pericarditis and tamponade? How does it happen? Is it all from smoking?
Well, pericarditis is the inflammation of the pericardium, which was caused by the MI she had earlier. Her pericardial membrane became inflamed and rough. Some of the clinical manifestations of pericarditis is cardiac tamponade, which is excess fluid in the sac, putting pressure on the heart. The heart then cannot properly fill with blood, and therefore is less blood leaves the heart. This results in a sharp drop of blood pressure, which would explain her chest pain, dizziness, and short of breath she was feeling.
My nursing diagnosis or biggest concern would be decreased cardiac output related to inadequate atrial filling, as evidenced by angina or chest pain, low blood pressure, shortness of breath, and fatigue.
When can she be sent home?
Her outcome goals before she is sent home is to ensure she demonstrates adequate cardiac output, as evidenced by blood pressure and pulse rate and rhythm within normal parameters for the patient. Strong peripheral pulses, an ability to tolerate activity without symptoms of dyspnea, syncope, or chest pain.
Is there anything that can be done for me? Will this heal?
I'm going to have you sent down for a pericardiocentesis, which is a needle that will remove the fluid that was built up. You are most likely going to be in the hospital for a few days and will be put on medications. I have also ordered metoprolol for you. This is going to slow your heart down by blocking beta blockers in the heart. You will also be receiving, beta receptors in the heart. You will also be receiving heparin while in the hospital and then warfarin at home. These both deactivate clotting factors.
Are there any major side effects with these medications? Because I will be watching her really closely at home.
A big concern while taking heparin and warfarin are risk for bleeding. She will want to be extra careful not to injure herself because her blood will not clot as easily, and it can be very difficult to clot. So she will bleed much more than normal. You'll want to check for any abnormal bleeding signs as well, such as bruising, bleeding gums, black tarry stools, or pain. Alyssa, you will not want to drink any alcohol or take any drugs like aspirin, non-steroidal anti-inflammatory drugs like ibuprofen or Motrin, because these will enhance the risk of bleeding. And do not drink any cranberry juice while taking warfarin.
And as for the metoprolol, you will want to monitor your heart rate. All you will need to do is count your pulse for 30 seconds. You can do it right here. And then multiply it by 2. A normal heart rate is between 60 and 100. So if you can just go like this and watch a clock for 30 seconds, and you should be all set, okay? With this drug, an adverse reaction can be a bradycardic pulse or a low pulse. If that happens, you should report to your healthcare provider immediately. You could also have dizziness, weakness, anxiety, and drowsiness. So try to avoid driving while on this as well. Abrupt withdrawal of the drug may precipitate life-threatening arrhythmias or myocardial ischemia.
Ms. Oliveira, can you tell me some unusual signs of bleeding?
Bruising, dark stool, and gums.
Nice. We will evaluate you throughout your stay at the hospital and continue to discuss your plans after discharge to you and your daughter. If she does not completely meet the needs of her desired outcomes, or rather partially meets the needs, then we'll just adjust our planning to meet the outcome goal.